Hi, welcome to the Addiction Recovery Place, the podcast champion addiction treatment specialists around the world. I'm very pleased today to introduce today's guest, Tony Miserandino, the program director at Wayward DUI, which is located in Algonquin, Illinois. This important service is a state licensed facility that provides driving under the influence related services and works with court ordered and voluntary clients. They offer a safe, confidential, compassionate, and non-judgmental treatment in a relaxed, laid-back, and comfortable setting. Their approach is innovative and has an exceptional success rate in helping those experience addictions. And we look forward to hearing about this vital service in today's podcast. So welcome to the Addiction Recovery Place podcast, Tony. It's great to have you with us here today. Thank you for joining us.
Thank you, Chris. I appreciate that.
No, very much appreciate your time. I'm going to start straight in because I know obviously you're incredibly busy. So tell us about your own journey and how you started Wayward DUI in Illinois.
Well, basically, I changed careers. I was working in the medical field and I was working a lot of hours and I wasn't home with my daughter. And so I decided that I would try and cut my hours down, and my boss actually at that time said no. So I went back to school. I went back to school at night and I watch my daughter during the day, and basically I've always had a passion for helping others. And so one of the things that I've been around pretty much my whole life has been substance use and addiction. And so I found that I could specialize in that. And so that's what my calling was. It was a calling to do this, to try and help others. And I believe that it's the right fit for me.
Perfect. No, well, that's a very commendable explanation there, Tony. If you don't mind me asking, how old were you when you went back to college to do the training?
I was 38 years old.
Wow. Well, congratulations. That's some achievement you've done there. So explain to us a little bit about your services and what you provide your community.
So basically what I do is I help people get their driver's license back for court and for the Secretary of State. If they get a charge against them for driving under the influence in Illinois, they have to do what's called a DUI evaluation.
Yes.
And then every time you do a DUI evaluation, the state of Illinois assigns a level of treatment to you. There's 4 levels there. And I also offer the classes that they have to take.
So can you describe to our audience the 4 levels of treatment and how this relates to your program?
Yeah, they're going away now from the risk levels. We still use them because the state of Illinois assigns them. But there's a low risk, a minimal risk, it's called. It's 10 hours of risk education, which is 10 hours of intervention / education. And then there's a level 2 moderate risk, which is 12 hours of counseling and 10 hours of risk education. And then there's the level 2 significant, which is 20 hours of counseling and 10 hours of risk education. And then the highest level, level 3, there'll be a high risk, that's 75 hours of counseling.
Okay. So what does it take for someone to get to the higher and lower risks kind of with the program?
Okay, so when we meet with someone, we usually meet with them between an hour and a half. And basically, we're gathering in a lot of the facts, the person's driving record. We go over their youth history. We go over the DSM-5 symptoms. There's 11 of those. And then we basically do what's called the Mortimer-Wilkins assessment. To try and get an idea of where the person is. Mortimer-Wilkins has been around for a while. And when you answer those questions, sometimes it's a cry for help. And, so we'll get a pretty good idea if the person, needing the help, wanting the help, that kind of thing. But it's a collaborative thing going on here, is that we're asking the person in an interview as well a whole bunch of questions too. So then what I do is I take that information and I go into the state of Illinois portal system and I enter all the information in there. And then the state of Illinois assigns the level of treatment, not
I
me.
see. I see. I see. So it's down to the actual state and not yourself as the assessor that does that. Okay, that's really interesting. So how do people come to access your service, and where do you receive most of your referrals from?
Well, a lot of people actually, there's a court list
Mhm.
in my county that, treatment providers are on the list. But a lot of times people Google DUI classes near me. And, then of course they call. And the two questions I get is, where exactly are you and how much is, you know,
Sure.
but yeah, it's usually the court. And then they usually will find me online through Google.
Yeah. So you get a lot of referrals online and through obviously the state. Okay. So with Illinois becoming a recreational state for cannabis, have you seen a big uptake in people accessing your services, especially for DUIs? Has that been something new?
Well, I would say, Chris, marijuana has always been the second most found drug in people's systems when they get pulled over for a DUI.
Mm-hmm.
The number one has always been alcohol, but since they legalized marijuana, I have done less drug testing. I would say the majority of people that I drug tested for in the past was for marijuana. I'm not seeing that much now. Yeah, of course, we're getting people that are getting DUIs, with marijuana in their system, still, of course, but I really don't know if the numbers have changed a whole lot.
Okay. Yeah, I just wanted to ask because obviously many states around the country now are opening up to recreational, and I was kind of wondering as well, Tony, what are the legalities for driving if you're a medical or recreational marijuana user in Illinois?
Well, this is pretty tricky because in Illinois, as far as I know, the police don't have a way to test somebody to see if someone recently smoked marijuana.
Okay.
And I know that the Germans in Germany, they have a swab, and
Mm,
I heard the Canadians have some kind of a box that a person could blow in. But essentially, if you have a medical card,
mm,
you have to be very careful because if you get pulled over,
mm,
um, the police could go on a Skype and pull a judge up if you don't want to blow in a breathalyzer. And
mm,
if the judge orders you to go to have your blood drawn, you go down to the hospital and have your blood drawn.
mhm,
And if you have smoked marijuana within 30 days, you're going to come up positive most likely because THC stays in your system. And
mm,
it's going to be very hard for you to prove in the court that
yes.
you didn't just recently smoke that marijuana.
Because there's no real ways of testing the levels of how under the influence you are, I suppose, and kind of how it affects because cannabis just sits dormant in your system for such a long time. So that was a you know question I've wanted to ask an expert for a long time as to how kind of the courts deal with this with obviously the legalities of marijuana around the country. I mean, here in Iowa, it's a zero tolerance. That's it. There's no let up in that. But I was wondering, coming from a legal state, kind of how you deal with it. So it's pretty much the same nationwide, I guess. Then really. So would you agree with that?
Yes, I would.
Hmm.
And like I said, if the person has a card for,
Yeah.
medicinal purposes, they have to be very careful,
Hmm.
because they get pulled over. And like I said, the police have, they draw the blood and it comes up positive for THC. The person has to then go in the court and prove or try and prove that they didn't just recently smoke that marijuana, which is very difficult.
That's probably next to impossible, I suppose, really, isn't it? I mean, how do you prove that over a month's period? So, yeah, that's a real tricky one, that's for sure. Um, so, Tony, what are the main drugs of choice that are most prevalent in your community, and how do you help address these in particular?
Well, I would say the majority of people that I see come to me for alcohol.
Yes.
Alcohol is a drug which most
Yes.
people don't think of it as.
Oh, it is.
It is a depressant drug, moves down the central nervous system and the vital functions of the body.
Hmm.
I would say then would be marijuana.
Hmm.
And then, of course, we have the occasional, we have cocaine.
Okay.
But those are the top three.
Hmm. Okay. And over the time that you've run Wayward DUI, have you seen any changes in drug use or even risks around drug use?
It's been people that use substances usually comes from an underlying issue.
Mm,
And 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 to use an analogy, if you think of a weed like a dandelion, what most people do is they take the lawnmower and they cut the dandelion. So on the surface of the grass, everything looks nice and normal, but underneath is that root. And if you don't really address the root cause of your problem or problems, that weed just keeps growing back in the person's life. And it could be a bunch of different drugs that people will experiment with.
mhm. Yep. Obviously, with dual drug use, that obviously increases risks as well, doesn't it? So if someone's using cocaine and alcohol, that has much bigger effects than just cocaine on its own or alcohol on its own. So when you're using two drugs at the same time or three even, the risks just keep escalating. So absolutely. So have you noticed more people accessing your services with addictions to opioids at all, and now with fentanyl in the mix? And have you heard about any more people overdosing or what they believe were opioids or even cocaine because of the fentanyl?
Yeah, this is the ongoing, probably escalating problem
Mhm.
all over.
Yes.
And I would say that the majority of people who are addicted to those type of drugs,
Mm,
they would go to either an inpatient
mm.
setting or an intensive outpatient.
Yes.
I'm what's called a outpatient. So meaning I don't see my clients for more than 2.5 to 3 hours at a time.
Mhm. Yep.
The majority of people using fentanyl or heroin and things like that,
Mm.
like I said, they would be looking at a higher level of treatment. Obviously, if they had a DUI, they do classes with me,
Yes.
to try and satisfy for court.
Mm.
But as far as that addiction goes, that one is a little bit deeper and more intense
Yes. Yeah. No.
than what I do.
Yeah. Very, very high risk as well, obviously. Okay. So,
Absolutely.
so through these podcasts that I've been doing over the last few months, Tony, I've discovered many different opinions on harm reduction. Harm reduction in the UK is very different to what I guess is harm reduction in America. But what I'm finding in America is different states kind of have different opinions or ways they describe harm reduction. So if you can tell us your ideal explanation of what harm reduction is to you, Tony, that'll be great.
Well, what we're trying to do with an individual is trying to get them to, change their ways as far as, their behaviors.
Mhm.
Cognitive behavioral therapy is one way.
Mhm.
In my field, we have a saying that thinking leads to drinking. So instead of drinking, we want to rewire their thinking and have them try and do something else instead. And that's the hard part because the people that are addicted or using that substance, they're using it for a specific reason, usually to feel good, to feel less bad, to escape a problem, to fit in with their peers.
Yes.
We there's steps that the state is doing as far as trying to, pump money into, the system for the treatment providers, for the clients and things. But, I would think the best would be to, outreach and education and things like that, before people even get involved with doing the substance.
Yep. Yeah, absolutely. No, that's a perfect description of harm reduction. So thank you very much indeed for that. Um, just going to move on for
You're
last
welcome.
couple. Just going to move on to the last couple of questions, Tony. Talk about you and what are the future? Have you any future plans at all for Wayward DUI? This is what's in the pipeline for you.
Well, I'm hoping that my daughter, she's in school right now. I'm hoping that she's wanting to be a counselor and that we could maybe open up another office or two. I can't do it alone,
Oh, yeah.
and I don't have any employees. It's just me. So, ideally, I'd like her to go to school, get her degree, and get her CADC like me.
Mhm.
And obviously, she wants to move on and get a master's or doctorate. But I wouldn't mind expanding.
That's wonderful. That's great news to hear, and it's very admirable to hear that your daughter wants to go into the same profession as her dad. So that says an awful lot about you as well. So that's amazing. So So where can people find you online if they need to speak with you or even access your service, Tony? So where could people find you?
So it's Wayward DUI Counseling. You just put that in the search engine. It's waywardduicounseling.com. Put in Wayward DUI, Illinois, obviously.
Yep.
But it'll pop up there.
Yep.
And
Excellent.
yeah, they could call me. They could also send me a personal message. It comes right to my email. Either way, it's fine. Calling me, emailing me, faxing me. Either way.
Yep. Fabulous. Excellent. So last thing, Tony, is there anything at all I've forgotten to mention, or is there anything you would like to add for our audience here today?
I would say when I get asked about addiction or, somebody comes to me and says, my brother is using, and they always ask, well, what can I do? What can I say? Because a lot of times families don't know how to cope with this. My answer is always have that person respect themselves and love themselves and actually care about themselves because the dangerous mind when it comes to this is the people that have just completely given up.
Mm.
They don't care anymore. And you know, if you care about your life, you're going to protect your health, you're going to protect your finances, you're going to protect your relationship. You're going to protect your driving privileges. You're just going to be more. And so that's really what it's really about is trying to help people recognize the importance of things in their life and those in their life and I say love themselves, but not in the vain way. I'm
Hmm.
talking about the caring way.
Yeah.
That's where I find a lot of people are lacking who use substances. A
Mm.
lot of them just don't care.
Okay.
And it's a shame.
It
It really
is.
is.
It is. Well, I don't think there could have been a better way of ending today's podcast, Tony, than that description. And thank you so much for your time, Tony. And I really appreciate you spending, 15 minutes with us today from your very busy schedule. And thanks very much indeed. I look forward to having you on again sometime. Thanks very much.
Anytime, Russ. Anytime. Thank you so much, sir. You're fantastic.
Oh,
Thank
you
you so
too.
much.
Thank you, Tony.